NMN marketing has become heavily invested in a particular narrative that NMN provides superior mitochondrial ND plus boosting, penetrates cells more effectively, and reaches the subcellular compartments where ND plus function matters most. These are compelling claims because mitochondrial ND plus is indeed critical for energy production and because better cellular delivery sounds like a meaningful technological advance. But when you examine the evidence behind these claims carefully, a pattern emerges. Most of the supporting data comes from theoretical mechanistic arguments or mouse studies, not controlled human trials demonstrating superior intracellular NAD plus accumulation in target tissues. This creates an interesting problem. NMN's mitochondrial superiority narrative may be real, or it may be theoretical advantage that doesn't survive contact with human biology. And niacin's mitochondrial effects are not well studied, which is a very different thing from being inferior. The research simply hasn't been done, in part because there's no patent incentive to fund it. Here's where formulation science becomes interesting. If the concern with niacin is delivery, that standard oral niacin might not optimally reach mitochondria or specific cellular compartments. That's a solvable engineering problem, not a fundamental molecular limitation. Liposomal delivery systems, which encapsulate a compound in lipid vesicles to improve absorption and potentially alter tissue distribution, could in principle enhance niacin's subcellular targeting at a fraction of NMN's cost. Sublingual administration bypasses first-pass hepatic metabolism, potentially raising peak plasma levels. Extended-release formulations sustain blood levels over longer windows, which may have different biological effects than pulse dosing. A genuine self-experiment comparing these delivery formats would be scientifically interesting and practically useful. Standard oral niacin versus liposomal niacin versus sublingual nicotinamide versus extended-release formats, each trialed for 4 weeks with consistent biomarker tracking. The question is whether delivery optimization can close whatever gap exists between niacin and NMN's claimed cellular advantages, and whether the cost of enhanced niacin formulations, which are still dramatically cheaper than NMN, justifies the potential benefit over standard niacin. The cost-effectiveness calculation here is worth making carefully. Liposomal niacin products are roughly 3 to 5 times more expensive than standard niacin. If liposomal delivery meaningfully enhances cellular uptake, you might be spending $60 to $100 per year instead of $20, still 10 to 20 times cheaper than NMN, while potentially capturing whatever delivery advantages premium precursors claim. That's a potentially attractive middle ground that the industry has little incentive to promote, because it undermines the NMN value proposition without elevating niacin to a patentable product. The mitochondrial claim, ultimately, is not a reason to default to NMN. It's a reason to take delivery science seriously across all ND plus precursors and to demand that cellular delivery advantages be proven in humans, not just asserted from mouse data.